equality becomes healthcare. For society to function best, its members must be able to function at their best. As anyone can need medical attention or know someone who does, it's in everyone's interest that all are taken care of.
American healthcare is not the best in the world, but despite that, we spend more per person annually on healthcare than any other developed nation. And a big part of the reason for that is that American hospitals overcharge patients massively. This neck brace is worth $20, but the hospital charged him $154. This IV bag costs less than $1, but she was charged $137. These are real prices, folks. 100 years ago, hospital pricing was pretty simple.
We take the cost of providing care and add a little on top to make a profit. One amputation costs us $5, so we'll charge you $6.50.
But after the rise of insurance companies, hospital billing got complicated, in part because these gigantic corporations demanded gigantic discounts.
We send you thousands of patients every day, so we want half off all your prices.
We can't afford that.
So to please these powerful insurance companies, hospitals cooked up a plan.
I've got it. We'll make up a really high fake price and then give you a discount off that.
Hey, as long as I get to tell my boss we got it cheaper.
If you ever lose insurance, you'll care. Because here's the really evil part. If you don't have insurance, you actually get charged these fake prices.
Well, thankfully, I have insurance, so the charge master doesn't affect me.
Unfortunately, it does.
Even if you're insured, you can get billed charge master prices if you go out of network. And anything can be out of network. The hospital you go to, the equipment used to treat you, even the doctors you see.
Aero specialist, out of network, I'm very expensive. Worse, every hospital has its own charge master. A treatment that costs $7,000 at one hospital could cost $100,000 down the road.
And you can't comparison shop when you're dying.
Which hospital you want, Moneybags Medical or St. Vincent's Discount Sick House? Moneybags it is.
Before antibiotics, if you got an infection, there was a high chance you'd die of it.
He's right. This guy stepped on a nail. Good chance he'll die. This woman had minor surgery. Great chance she'll die. All these people will probably die. Being a doctor in the past is fun.
But all that changed in 1928 when one scientist got super lucky. One weekend, Alexander Fleming accidentally left out a petri dish filled with bacteria. And when he returned, he found that the bacteria had been destroyed by mold. This led to the discovery of the first antibiotic, penicillin. It saved countless lives and earned Fleming the Nobel Prize.
What's the issue then? Seems like everything is great.
For a few decades, it was, until the rise of resistant bacteria. When you take antibiotics, you're trying to kill all the bad bacteria in your system. But sometimes, like if you don't finish your antibiotics, or just through random chance, a few of these bio-bullies develop resistance.
I'm okay. I'm okay. I'm resistant.
Once that happens, resistance can spread. First to other bacteria, then to other people. Over time, these protected pathogens can propagate all over the planet. And when that happens, the antibiotic becomes useless. Once we start using a new antibiotic, it's only a matter of time before resistance develops. Penicillin was a miracle drug, but bacteria became resistant to it in just a few years.
But there are other antibiotics, right? Please say yes.
Yes, but the same thing is happening to them too. And we're speeding that process up because antibiotics are insanely overprescribed. Even though they have no effect on colds and flus, doctors hand out antibiotics to patients just because they ask. According to the CDC, at least 1/3 of antibiotics are unnecessarily prescribed.
Rachel, antibiotics are really tricky to develop, so it takes a long time. In fact, we haven't had a totally new class of antibiotics since the late 80s.
What have you scientists been doing all this time?
Well, we're trying, but it's also hard to convince pharmaceutical companies to make new antibiotics because they don't make a lot of money.
Yeah, they just save lives. If antibiotic resistance becomes the norm, infections will come back in full force, and we'll lose the ability to safely perform organ transplants, chemotherapy, and even routine surgeries. All of modern medicine is built on a foundation of effective antibiotics. If we lose them, we lose everything.
The bad old days will be back again.
In the United States, we undergo 100 million CT and MRI scans a year and almost 10 billion lab tests. We're overtreating ourselves to the tune of $226 billion a year. We pay more per person in healthcare than any other country, and we're not any healthier for it.